I would now like to introduce my colleague at Southwest PA Environmental Health Project. Dr. David Brown is a public health scientist at EHP, a nonprofit public health organization that assists and supports residents who believe their health may be impacted by unconventional oil and gas development. Dr. Brown is also the public health toxicologist and director of public health toxicology for Environment and Health Incorporated. He has served as the chief of environmental epidemiology and occupational health in Connecticut and an associate professor of toxicology at Northeastern College of Pharmacy and Allied Health, and as deputy director of the Public Health Practice Group of Agency for Toxic Substances and Disease Registry at the National Centers for Disease Control and Prevention in Atlanta. Dr. Brown graduated from Cornell University in biochemistry, received his MS from the University of California in environmental health, and his doctorate of science from Harvard School of Public Health and Toxicology. Welcome, Dr. Brown.
First of all, thank you very much for asking us to present this paper. This work, an exposure assessment of adults exposed to natural gas and their reported health symptoms, is a result of work done by the Environmental Health Project. The Environmental Health Project was started, you just heard a little bit about it. It was started in 2012 with the role of addressing the public health concerns within a community. As part of that public health role, we go to communities, people in communities, houses, residents, and we do three things. We do a health intake. We look at do an environmental assessment. We leave a meter behind, a air meter behind, so we can measure exposures over time. And then we provide them advice for the reduction of exposures. So we're essentially a public health organization. I'm going to talk about how some data that we have attained is analyzed or was analyzed in what may be a unique approach. It was developed from ecological methodologies by Brian Utz, who is one of our authors. The work was done by Hannah Blen, and Lydia Greiner put together our health data for us. So if I could see the next slide, please. I'll just say that when I added them up in 2017, there were roughly 7,500 active well sites in Pennsylvania and over 3,000 in Southwest Pennsylvania. And what you're seeing here are sites in Southwest Pennsylvania. These are gas wells or gas pads. Any one of those dots could have from 1 to, I don't know, maybe 10 or 20 wells on top of them. And around them, there will also be compressor stations and other activities. We were asked to, we began in 2012, our study, our work. From 2012 to 2017 and beyond, we would actually send a health provider to the home of residents of people who would do a health intake and collect data on these, collect a specific set of health symptoms and data on our people. They found an array of health symptoms, and you'll see a little bit more of what they were like in just a moment. But they were comparable to what other people are also reporting. Could you go to the next slide, please? I'm going to try to stay away from jargon. I'm not going to be very successful, but I'm going to try to stay away from jargon. One of the things you find out about this data, both the health data and the exposure data, as Dr. Diesel has pointed out, is it is incredibly variable. In fact, it is so variable that linear statistical methods generally are not successful when it's analyzed because they have multiple components. So one has to resort to some other methodology when you're looking at data sets. Parametric statistics aren't working, but they're not normally because the data simply are not normally distributed. Therefore, we're going to look at an approach, actually a two-step approach that examined using something called general linearized modeling. And I'll talk a little bit about that in a moment after we see the next slide. Okay. There were two sets of data that were compared. Health intake data. Now, our health intake data that went into this slide, we published it, but basically, a nurse practitioner would go with a structured question form, and she would interview adults in the homes and ask them or collect symptoms that they reported to her or him. We had at that point about 135 adult health assessments. Those health assessments were then reviewed by a panel to determine which symptoms were possibly related to another health condition that the person had. For example, the person had asthma or the person had diabetes, we'd expect to see diabetes symptoms. So we screened our data set for that, and we ended up with about 104 clean data sets from this. We only looked at older residents. We removed workers, and as I just mentioned, we validated the symptoms. So we had a fairly good data analysis. But remember, this was collected for us to figure out how we should advise a person to protect themselves. It was not collected necessarily to do a research study with. Hannah Blinn came to us and she asked us if she could review this data, if she could use this data in what turned out to be a very interesting study. She wanted to compare the closeness of the wells to the health effects that people were seeing. She had three well exposure well data systems that we were measuring. I'm sorry, this slide changed a little bit, but it worked fine. The first measurement was cumulative well density. How many wells were around the site, around the person? The second is the inverse distance weighting measurement. It's a proximity measurement that Dr. Lisa McKenzie just mentioned. The third was a methodology that we had been using to try to get an idea of what the exposure to the major chemicals being released were to people who at residences. And it's a modeling system, which we've also reported, where we identified the hourly exposure based on the annual emissions from a well, and then looked at the 90th percentile, because we were noticed that effects were higher when people saw peak exposure. Again, we had variable wells between the sites. The emissions were also variable, and the activity that goes on sites, as you just noticed, are highly disruptive, as we just looked at. Could I see the next slide, please? Okay. In terms of symptoms that we saw, these are the first 10 of 52 symptoms of 34 symptoms that we're going to talk about. But on the left-hand side, you'll see the array of symptoms. They range from sore throat, headache, difficulty speaking, strange symptom, cough, itchy and burning eyes, stress, anxiety, worry, fatigue, and sinus infections. These are symptoms that people told us about. No symptom appeared in every person. In fact, the largest incidence of any single symptom was about a third of the people. And no person, thank God, had all of the symptoms. Could we move on to the next slide, please? Okay. Toxicologists don't study symptoms. Toxicologists study target organs. So it was important for us to try to decide which target organs seem to be affected by exposure based on the symptoms that we were looking at. This table, just a simple table on the left-hand side, it lists the target organs of interest, and on the right-hand side, it lists the symptoms that appeared. And this is not the data that we analyzed, but this is the model that we used to get that data. Could you go to the next slide, please? Okay. One of the ways to look at this information from an ecological standpoint is to realize that, in fact, the data is not linear. By not linear, I mean it does not go as you increase distance or number of wells, or the data is not linear. You don't get a relative increase for each increase in the relative wells. What you do get are slightly higher values, but we don't really know the shape of that curve. In order to get out of the first step in this analysis was to look at different distances from wells and then look at different shapes of the curve. So if you imagine we looked at 10 distances from the wells, from 1 kilometer out to 10 kilometers, and then looked at the shapes of curves from straight lines to highly curved lines, and do that for 100 linear assumptions for each one of our potential well exposures. Once that is done, one can do a best fit analysis of the data using a least squares type calculation. Once that is done, and you can, using the best fit calculation, you can say which set of data, which expression of these 100 expressions best fits your data. We took 100 nonlinear assumptions, determined the best fit of the data, and then we looked to see what were the conditions that this best fit piece came out of, this best fit came out of. When we identified that, it was 5 kilometers or 3 miles. So when we used a distance of 5 kilometers or 3 miles around, we got the best fit for our information. Next step in the process is to test the significance of that relationship. And that's between the number of responses and distances from the sources. All 3 of our criteria met the p less than 0.05 level of significance. You can see the next slide now. I may be able to straighten that out. On the far, okay, that's correct. On the far left-hand panel, you'll see, if I can get my cursor on here. Across here are the number is well density. These are.
We can't see your cursor, just so you know. I can try to mimic where you want me to put the cursor.
Okay. The vertical axis is the number of symptoms reported by each subject. Each dot is a subject. The cursor where the curve that you see is the best fit curve. The gray area is a 95% confidence limit, and based on this, we see that is the best fit for the data that we have for well density. So across the bottom is increased well density. The next panel over shows the effect if we look at proximity. That's the inverse distance squared. We see a similar kind of effect, the same numbers that are there. And again, we see a slightly different curve for proximity and effects. We go to the next slide over, next panel over. Now this panel I'm going to take a moment to explain. We looked at the 90th percentile of the hourly air impacts estimated at each residence. And the compounds that were in that were modeled were 4. They were nitrogen oxide, carbon monoxide, volatile organic hydrocarbons, and PM 2.5. That represents, if we look at the Marcellus Shale inventory data, that represents between 85 and 95% of the tons emitted from the average site in Pennsylvania. This curve you see is also more linear than others, but it shows a significant increase as the data goes from, as we go from very low exposures to very high, to relatively high exposures calculated at each particular site. Could I see the next slide, please? Okay. Mark, if you can go to the upper place that says CWD, that's the density data. And if you go all the way to the right, you'll see the significance values. They're all significant except for age. If you go over and to the variable, it'll tell you that there's an intercept, and that estimate is about 3.3. That's what we would have expected to see if there was no exposure. And we go down, the next down, it says, what do we see with smoking? Next is what do we see with gender? And the next is what do we see with the total density of the wells. The next panel down, or next part of the panel down, shows exactly the same thing. And if you go to the far right, again, you'll see the same kind of outcomes. Those are p-values. These look like significant data. We go to the next column down. This is the adjusted exposure variable, and we see the essentially an intercept is fairly close to that. Again, we go to the far right. I'm sorry, Mark, I'm going to drive you crazy. This is they're significant. We're not quite as, the significant level is not quite as high for the exposure estimates, and those exposure estimates there are in micrograms per meter cubed per hour. Could we go to the next slide? Okay. Losing my place here. Okay. What we've shown you is a result that you get when you look at the total number of symptoms that people are reporting. Now, in the second stage of this ecological thing is a estimate of threshold index taxia analysis. That means what you're doing in this analysis is to try to determine which piece of that or health effect is contributing to the gradient or the slope in that curve. And we can look at that proportionally for each observation and each gradient. Again, remember, we have multiple symptoms contributing to these effects. We go to the next slide. This is, let's see.
Sorry about that. It just jumped to 2, but I think this is the next slide.
Yeah, I think it is too. Okay. The first is a density slide. And this slide has just a ton of information on it, and I'll try to make it, I'll try to help you with it a little bit. The ordinate, far left. Okay. The ordinate is an index value ranging from 0 to 100 rather. 100 says that the element perfectly follows the curve. And it can go to a negative also, so the rule is from 100 to 0 to 100. Across the bottom of the slide is a list of the symptoms that were contributing to the effect. If you go over to the far right-hand side, you'll see those boxes there. I'm pointing. I'm sorry. Right there, they indicate the organ systems or the systems that appear to be affected, and different colors indicate different organ systems. In the heights of the bars indicate how well the data fit. The first thing, surprising thing about this was that many factors were actually fitting these data. The top 4, eyes, stress, dry skin, difficulty sleeping, dizziness, trouble with concentrations, are the higher contributors, but they all contribute a little bit. Over to the left-hand side, far left-hand side, we see 3 that appear to be going the same way. That doesn't mean that they're not important. It means they do not fit the slope of this particular data. This really suggests to us that there's a syndrome of health effects that should expect around these sites. Now remember, these are immediate symptoms that people tell us about. We're not looking at cancer or anything like that. Let's see what happened when we looked at closeness of the well, proximity. The proximity, I'm not going to describe it all again, but if you go and look at the bars again, you'll see that difficulty sleeping, stress, nasal discharge, eyes, fatigue, and abdominal pain are higher contributors. But again, we see a whole series of effects that are associated with that. Some of them are psychological, which we kind of expect. One of them has skin in it. And then we see the same effect on the other side, where headache, rash, and difficulty. I'm sleeping. I guess that one is there. It's kind of hard to read.
Speaking.
Yeah. Is it sleeping? Speaking. Oh, I thought, thank God. Okay. Can we go to the next one, please? This is what happened when we modeled the 90th percentile. Now, essentially what I think we're modeling here are the peak exposures of the estimated hourly value using the entire year when the study was, when the intake was taken. So, and in this, we have fewer effects showing, we have fewer responses, but the responses again that we see are difficulty sleeping, stress, nasal discharge, an eye effect, fatigue, and abdominal pain. Again, showing slightly different gradient depending on what we're looking at. Could I see the next slide, please? Okay. I wanted to go back and just a reminder, show you how we envision this data fitting into a model. If we look at the density on the far right, you'll see that 16 of the 34 symptoms actually seem to be related to the density of the wells. And we know what those are because we just saw them. We go down to the next, look at inverse distance weighting, we find 24 of the symptoms are identified with distance weighting. And that means that they fit the curve best. And the last one shows the actual emissions thing. And there we see 14 of 34 symptoms showing effects. Again, indicating, depending on how you look at the data or how we evaluate our data, we have 9, 10, or 7 organ systems potentially involved. But the analysis was surprisingly satisfying to me because it meant we could see which organs appeared to be affected and what they were affected by. It doesn't look like the whole effect is at least those 4 gases that we measured. It looks like the effect are other things that are going on around the wells, or it's other agents that were in the emissions that we didn't see, or there could have been water effects that we had. Can I see the next slide, please? I'm showing you this slide just to try to illustrate how variable this data can be. This is a compressor station. Across the bottom it indicates, if you can, okay, you got it. I'm sorry, across the bottom, each indicates what activity was going on this particular compressor station for the year that we evaluated it. The off to the angle, it indicates the chemicals that the company had to report were released. And we can see that depending on what's going on at the site, a different array of chemicals are being reported from different sites. I'm not going to show you, we've got other site data, which shows us that there's incredible variability around what's coming off of these sites at different times. And you should notice that the formaldehyde level is truncated. Actually, the major emission from this site is formaldehyde. And this is just looking at VOCs. Next slide.
Great. We're about out of time on your presentation duration, and so if you could try to wrap up quickly, that'd be great.
I'll do that. Okay. First question is, what does this mean? It means health and wellness effects are present 3 miles from the shale site. There's a complex effects are produced by the exposure variables. It's obvious that increasing infrastructure and facilities are going to increase the health impacts, and the communities are disrupted. And I think the last slide. Okay. What does all this mean? Well, one thing it means that if we're going to look for health effects around sites, we're not going to get very far looking at single health effects. We're going to have to look at array, possibly the effects of some sites. And to do that, we're using something called the SF36, which I can explain later. We can determine the chemicals that are associated with the effects. We can determine the activities on the sites associated with presence of health effects using this methodology. We have some information on setback questions. And we also have information on aggregated sources. And I think I'll stop there.